Good morning. My name is Denise Brew. I'm the Executive Director for the Council for Children and Adolescents with Chronic Health Conditions here in New Hampshire. For the past year, the New Hampshire Partnership to Fight Chronic Disease has worked to raise awareness of the toll that chronic disease takes on our communities and our families, and especially our children. Today we welcome Dr. Richard Carmona, the 17th Surgeon General of the United States. He is also the National Chairperson of the Partnership to Fight Chronic Disease in New Hampshire, and he is here to announce two major efforts. Dr. Carmona has had a distinguished career as both a healthcare leader and an expert in special operations and emergency preparedness, culminating in his service as Surgeon General. Prior to his career in the fields of medicine and public health, Dr. Carmona served in the U.S. Army, ultimately becoming a combat-decorated Vietnam veteran, earning both the Bronze Star and Purple Heart. I am pleased to announce Dr. Richard Carmona.
Good morning, ladies and gentlemen. My name is Richard Carmona, and I'm here representing the Partnership to Fight Chronic Disease. I'm the National Chairman. And the Partnership to Fight Chronic Disease is made up of over 80 organizations, both from the business sector, from the health sector, individuals, advocacy groups. But we all come together for one purpose, and that is to address the issue of chronic disease in our society today. We spend about 16% of our gross national product on health care. That's over $2 trillion per year. And yet we know that about 75 cents on every dollar spent is on chronic diseases. A great deal of those are preventable. Chronic diseases are things like diabetes, obesity, cancers, asthma in children. The great majority of those are preventable, or at least can be mitigated if detected early. What the partnership is here to do is to work with your leaders here, and we're very, very happy that Dr. Susan Lynch, your First Lady, who's a pediatrician in her own right and a specialist in lipid disorders, has agreed to be the New Hampshire honorary chair. But the groups in New Hampshire are coming together with the other states and our national coalitions to address these issues of chronic disease. And one of the reasons I'm here today, no surprise to any of you, is that tomorrow there's a debate with some of the candidates for president. And we want to make sure that these presidential aspirants are all aware of the issues of chronic disease, and that each and every one of them puts this high on their priorities and has a plan to address chronic diseases. And there's many plans. In the Partnership to Fight Chronic Disease, we are not prescriptive. We're not telling any candidate what to say or what program may work best, nor are we partisan in any way. We feel that it is the obligation of every presidential candidate to be aware of the issue of chronic diseases, to be aware of the Partnership to Fight Chronic Diseases, and to make sure that this is high on their agenda to address. We ask that the citizens of New Hampshire, as well as your elected officials, editorial boards, everybody, hold these presidential aspirants accountable. Ask them questions that go far beyond the usual platitudes of political persons, but in-depth questions about their understanding of chronic disease, the burden it relates to in our nation, both economically and disease-wise, and if elected, what is it that they are going to do specifically to address these issues? If we look at the platform that we work from in the Partnership to Fight Chronic Disease, we give some general advice. There are issues of moving our nation from one that embraces care to one that embraces prevention, health, and wellness. Figuring out economic systems that will reward our providers to keep people healthy rather than letting them get sick and then rewarding them to care for somebody who is sick. Providing economic incentives to researchers, to clinicians for innovative ways to be able to address chronic diseases in our society. Improve the infrastructure of our healthcare systems through health information technology to reduce errors in the practice of medicine, to identify patients earlier who have chronic diseases, and to also track those patients as to, are they responding, are they getting better, are we preventing or mitigating their chronic disease. Most of what we're dealing with in chronic disease in this nation is preventable or at least mitigatable if we understand these problems and we get a commitment from our elected officials, especially this group of presidential aspirants, to make this a very high priority. The number one domestic priority based on all the polling in the United States is health. And the American public expects and hopefully will hold accountable all of these presidential aspirants to deal with the issue of chronic disease in our nation. Thanks for your time, and happy to answer any questions you may have.
Does any candidate stand out as being particularly proactive on this?
Every candidate has begun to incorporate health and the issue of chronic disease within their platform. We are very happy about seeing that. The Partnership to Fight Chronic Disease has worked diligently over the last several months to make sure that we are heard, and all of the candidates' teams have incorporated some of these ideas into their platforms. Right now, we're hearing discussions that are very good. There's no one candidate that we're favoring. Again, this is a nonpartisan group, and we want to just make sure that every candidate is aware and makes a commitment to deal with chronic disease.
Isn't there a move among private insurers to kind of take a lot of the steps that you described, emphasis on prevention rather than care after someone has these diseases, because it makes economic sense for them too?
Yes, it does. And we're starting to see changes, albeit very slowly. The science of prevention and health and achieving optimal wellness have been before us for decades. But the acceptance and incorporation of prevention and health and wellness into our health system has been very small, even within the federal government and the private sector. Insurance companies have been challenged because of the migratory nature of our patients, our citizens, who are in one plan for a couple of years and then another. And we know that the investment for prevention is a great investment, but often is not appreciated until years down the line. And what we're hoping is that all insurers will see the value of working collectively to improve the health status of Americans through prevention and wellness. And again, that's one of the themes that we are speaking of through the Partnership to Fight Chronic Disease. Yes, sir?
You have a very impressive list of stakeholders who signed on to the partnership, but I'm wondering, there are some pretty significant stakeholders that I didn't see sign on, including the American Medical Association, the American College of Physicians, American Academy of Pediatrics. I'm curious if those stakeholders have been approached, and if they haven't signed on, and if they've been approached, why not?
We are a relatively new organization, and every day we have new partners joining us. For some of the larger organizations, some of which you've mentioned, it's not a single individual. They have to take the platform, present it to a board. We have to wait for a board meeting to get the input back from their board. So some of these are in progress. The organizations you mentioned, like the AMA, Academy of Pediatrics, have been asked, and they're going through their processes now to give us input as to whether or not they will join. Just this morning, though, your First Lady, Susan Lynch, Dr. Susan Lynch, commented that you know, the platform of the PFCD is really the one that she has worked with for many years, even before becoming the chairperson here in New Hampshire, and feels that it is what we need to do as a nation.
What's it going to cost to do it?
Well, really, the cost is very little. It's about commitment. It's about each of us taking some responsibility for our health, walk a little more every day, eat a little less, eat healthier portions, taking some responsibility for your own life to reduce the burden of chronic disease. But we need to be able to develop that as a culture. Not just the individual, but every place our children go, they should be seeing examples of healthy living through physical activity, through healthy eating, through reducing risk, wearing a seatbelt, wear a helmet. Every one of those variables that contributes to chronic disease, we need to emphasize, and it just needs to become part of our culture. It's not there yet. Because we have to have a press conference like this to talk about prevention and health and wellness, obviously it's not there yet, and why we appreciate the media taking the time to get this word out. We can't afford the trajectory we're on now. We're spending 16% of our gross national product on health care. 3/4 of those dollars are for diseases that are preventable. If we let this continue, in the next few years we'll be spending 20% of our gross national product, for over $4 trillion, and the legacy we leave our children is unsustainable. It's going to break the bank, not to mention the disease burden that the children will inherit. So we must do something about it.